Introduction. Nervous system is the chief controlling and coordinating system of the body. It is responsible for judgment, intelligence, and memory. Nervous system is highly evolved at the cost of regeneration. It is complex. It is the most complex system of the body. It adjusts the body to the surroundings and regulate all bodily activities, both voluntary and involuntary. The sensory part of the nervous system collects information from the surrounding and helps in gaining knowledge and experience, whereas the motor part is responsible for responses of the body. Average weight of adult brain in air is 1500 to 2000 grams. Since brain floats in cerebrospinal fluid, it only weighs 15 grams, which is comfortable. There are about 180 to 200 billion neurons in an adult brain, very rich. Divisions of nervous system. Anatomical. It is divided into 1. Central nervous system, which comprises brain and spinal cord. It is responsible for integrating, coordinating the sensory information and ordering appropriate motor actions. Central nervous system is seat of learning, memory, intelligence, and emotions. Peripheral nervous system includes 12 pair of cranial nerves and 31 pair of spinal nerves. This provides afferent impulse to central nervous system and carries efferent impulse to muscles, glands, and blood vessels. Flowchart 1.1. Flowchart 1.1. Division of nervous system. Nervous system is divided into central nervous system and peripheral nervous system. Central nervous system is divided into brain and spinal cord. Peripheral nervous system is divided into somatic nervous system and autonomic nervous system. Somatic nervous system is divided into 12 pairs of cranial nerves, 31 pairs of spinal nerves. And autonomic nervous system is divided into sympathetic nervous system and parasympathetic nervous system. Functional. Peripheral nervous system functionally has two components. Afferent component provides sensory information to central nervous system. Efferent component carries motor information to muscles, glands, blood vessels, and heart via somatic nervous system for the control of skeletal muscles, autonomic nervous system for control of heart, smooth muscle of the organs, glands, and blood vessels. It is divided into sympathetic and parasympathetic parts. Cellular architecture. The nervous tissue is made up of 1. Nerve cells of neurons, nerve cells or neurons, figure 1.1. 2. Neuroglial cells, neuroglia, forming the supporting connective tissue of the central nervous system. In peripheral nervous system, these are replaced by Schwann cells. Both types of cells are supplied by abundant blood vessels. Neuron. Each neuron is made up of the following: 1. Cell body, collectively forms gray matter, the nuclei in the central nervous system, and ganglia in the peripheral nervous system. Second, cell process of two varieties: dendrites, Greek branch of a tree, are many short, richly branched, and often varicose. B. The axon is a single elongated process. Collectively, the axon forms tracts, white matter in the central nervous system, and nerves in the peripheral nervous system. The branches of axons often arise at right angle and are called collaterals. Functionally, each neuron is specialized for sensitivity and conductivity. The impulse can flow in them with great rapidity, in some cases about 125 meters per second. A neuron shows dynamic polarity in its process. The impulse flow towards the cell body in the dendrites and away from the cell body in the axons. Figure 1.1. Classification of neurons according to the number of their processes. 1. Multipolar neurons. Most of the neurons in man are multipolar. Example, all motor and internuncial neurons. Second, bipolar neuron are confined to the first neuron of the retina, ganglia of 8th cranial nerve, and the olfactory mucosa. Third, pseudo-unipolar neurons are actually unipolar to begin with but become bipolar functionally and are found in dorsal nerve root ganglia and sensory ganglia of the cranial nerves. Figure 1.2b. 4. Unipolar neurons are present in the mesencephalic nucleus of trigeminal nerve and also occur during fetal life. These cells are more common in lower vertebrates. According to length of axon, 1. Golgi type 1. These neurons have long axons and numerous short dendrites. These are seen in pyramidal cells of cerebral cortex, Purkinje cells of cerebellum, and anterior horn cells of spinal cord. 2. Golgi type 2. These are neurons with short axons and established synapses with neighboring neurons. These are also seen in cerebral and cerebellar cortices. Amacrine neurons without axon, only with dendrite. They are seen in retina of eyeball. Mature neuron is incapable of dividing. Recently, some neurons in olfactory region and hippocampus have been seen to divide. Brain tumors arise chiefly from the neuroglial cells. Functional classification. Neurons are classified into sensory neurons, motor neurons, and autonomic neurons. It is parasympathetic and sympathetic neurons. Sensory neurons, these are three types. 1. Primary or first order sensory neurons are present as spinal or sensory neurons in the dorsal root ganglia of spinal nerves. Second order sensory neurons are present in the gray matter of spinal cord and in brainstem. Third, tertiary or third order sensory neurons are seen in thalamus. Motor neurons. These carry impulse from central nervous system to distal part of the body. These somatic motor neurons are of two types. First, upper motor neurons are situated in the motor areas of brain. These synapse with cranial nerve nuclei and anterior horn of spinal cord. Lower motor neurons are located in cranial nerve nuclei and anterior horn of spinal cord. Nerves emerging from these nuclei supply the various skeletal muscles. See figure 3.10. Parasympathetic neurons, autonomic. First, preganglionic neurons are located in cranial nerves 3, 7, 9, and 10. Also in sacral 2 to 4 segment of the spinal cord. Postganglionic neurons are located close to the wall or within the wall of the viscera. Third, the parasympathetic outflow is called craniosacral outflow. Sympathetic neurons, autonomic. 1. Preganglionic neurons are located in the lateral horn of thoracic 1 to lumbar 2 segment of the spinal cord. Second, postganglionic neurons are situated in the ganglia of the sympathetic trunk away from the viscera. Third, the sympathetic outflow is called thoracolumbar outflow. According to shape, figure 1.4, stellate, basket, fusiform, pyramidal. According to size, macroneuron, more than 7 micrometer size, example bed cells. Microneurons less than 7 micrometer size, example granular cells. Synapse, the neurons are connected to one another by their process, forming long chains along with the impulses are conducted. The site of contact contiguity without continuity between the nerve cell is known as synapse. Greek together. Figure 1.5. One cell may establish such contact through its dendrites with as many as 1000 axon terminals. However, it must be remembered that each neuron is an independent unit and the contact between neuron is by contiguity and not by continuity. Neuron theory of Walder 1891. The impulse is transmitted across a synapse through biochemical neurotransmitters acetylcholine. Neuroglial cells. Various types of neuroglial Greek nerve glue cells are as follows. 1. Astrocytes, concerned with nutrition of the nervous tissue, are star-shaped cells. These form blood-brain barrier. These are of two types: protoplasmic, figure 1.6a, and fibrous, figure 1.6b. Astrocytes are absent in pineal gland and posterior pituitary. Second, oligodendrocytes are counterparts of Schwann cells. Schwann cells myelinate the peripheral nerves. Oligodendrocytes myelinate the tracts. Third, microglia, Greek small glue, behave like macrophages of the central nervous system. They develop from mesoderm, figure 1.6d. 4. Ependymal cells are columnar cells lining the cavities of the central nervous system, figure 1.6e. Fifth, Schwann cells. Various features of these cells are shown in table 1.1. Proliferation of glial cells is called the gliosis. A central nervous system lesion heals by gliosis. A spontaneous gliosis is an indication of degenerative change in the nervous tissue. Since the glial cells are capable of dividing, they can form the central nervous system tumors. Types of neuroglial cells, table 1.1. Types of neuroglial cells. Cell size, there are protoplasmic astrocytes, fibroastrocytes, oligodendrocytes, microglia. Protoplasmic astrocyte cell size large, shape of nucleus oval, light stained. Cytoplasmic process many, short and thick. Cytoplasm granular. Situation gray matter. Function blood brain barrier. Embryological origin neural crest. Fibrous astrocyte cell size large, shape of nucleus oval, lightly stained. Cytoplasmic process many, long slender. Cytoplasm fibrillar. Situation white matter. Function blood brain barrier. Embryological origin neural crest. Oligodendrocyte. cell size medium, shape of nucleus small, spherical, dark stained. Cytoplasmic process few short beaded. Cytoplasm situation dash cytoplasm dash and situation white matter function myelination embryological origin neural crest microglia cell size small elongated shape of nucleus small elongated dark stained cytoplasmic process short thin spinous cytoplasm not present situation gray and white matters function phagocytosis embryological origin mesoderm gray matter and white matter unit of nervous tissue is the neuron comprising of cell body dendrites and axon. Neurons are supported by neuroglia and blood vessels. Gray matter is a part of nervous tissue containing the cell body soma neuroglial cells and abundance of vessels. It covers the outer aspect of brain and is known as the cortex. Gray matter present within the depth of white matter is called ganglia or nuclei. White matter comprise only the fibers. It is axons, dendrites, neuroglial cells and fewer blood vessels. In brain, white matter lies deep to cortex of brain. In the spinal cord, white matter lies superficially to the deeply placed H-shaped gray matter. Reflex arc. A reflex arc is the functional unit of the nervous system in its simplest form, monosynaptic reflex arc. It consists of one a receptor, example the skin or muscle, second the sensory neuron, third the motor neuron, fourth the effector, example the muscle. In complex form of the reflex arc, the internuncial interneurons are interposed between the sensory and motor neurons. An involuntary motor response to a sensory stimulus is known as the reflex action. Only cortical responses are voluntary in nature. All subcortical responses are involuntary and therefore are the reflex activities. Reflex action is chief function of spinal cord. Knee jerk and ankle jerk are monosynaptic reflex arcs. Some common reflex arcs are shown in table 1.2. Table 1.2 some common some some common reflexes. Name of reflex, way of eliciting result, comment. Bicep jerk, way of eliciting striking bicep brachii tendon, result flexion of the elbow joint, comment. C5, C6 segments intact. Tendon jerks may exaggerate in upper motor neurons lesion or lost in lower motor neuron lesion. Tricep jerk, way of eliciting striking tricep brachii tendon, result extension of the elbow joint, comment. C7, C8 segment intact. Knee jerk, way of eliciting striking the ligamentum patella, result extension of the knee joint, comment. L3, L4 segment of spinal cord intact. Ankle jerk, way of eliciting striking tendon tendocalcaneus, result plantar flexion of the ankle joint, comment. S1, S2 segment intact. Abdominal reflex, striking a quadrant of abdomen, uh, result contraction of abdominal muscles. Comment. Positive reflex indicates normal pyramidal tract with T7 to T12 nerves intact. Plantar reflex, way of eliciting scratching the sole of foot from lateral side towards big toe, result plantar flexion of the great toe and other toes. Comment. A normal plantar response indicates intact pyramidal tract. Babinski's sign, way of eliciting same as in plantar reflex, dorsiflexion of the great toe and fanning of other toes. Comment. Babinski's sign indicates pyramidal tract injury except in infants. Parts of nervous system. Parts of the nervous system. Central nervous system. Central nervous system component of central nervous system. The spinal cord, it extends from the base of the skull to the lower border of first lumbar vertebra in an adult. The spinal cord receives sensory information from the skin, joints and muscles of the trunk and limbs and contains the motor neurons responsible for both voluntary and reflex movements. It also receives sensory information from the internal organs and control many visceral functions. Within the spinal cord, there is an orderly arrangement of sensory cell groups that receive input from the periphery and motor cell groups that control specific muscle groups. In addition, the spinal cord contains ascending pathway through which sensory information reaches the brain and descending pathway that relay motor command from the brain to motor neurons. The gray matter is in the center and white matter is at the periphery. Cerebrospinal fluid containing central canal lies in the gray matter. Second, brainstem, it includes the medulla. The medulla, this is direct rostral extension of the spinal cord. It participates in regulating blood pressure and respiration control. It resembles the spinal cord in both organization and function. B. The pons. It lies rostral to the medulla and contains the large number of neurons that relay information from the cerebral hemisphere to the cerebellum. C. The midbrain. This is smallest brainstem component which lies rostral to the pons. The midbrain contains essential relay nuclei of the auditory and visual system. Several regions of this structure play an important role in the direct contact of eye movement, whereas others are involved in motor control of skeletal muscles. Third, cerebellum. The cerebellum lies dorsal to the pons and medulla. It has a corrugated surface. The cerebellum receives somatosensory input from the spinal cord, motor information from the cerebral cortex, and balance information from the vestibular organs of the inner ear. The cerebellum integrates the information and coordinates the planning, timing, and patterning of skeletal muscle contraction during movement. The cerebellum plays a major role in the control of tone, equilibrium, and posture, including head and eye movement. The diencephalon. Fourth, the diencephalon. It includes the thalamus and hypothalamus. It is present between the cerebral hemisphere and the midbrain. The thalamus receives almost all sensory and motor information going to the cerebral cortex except smell. It regulates level of awareness and some emotional aspects of sensory experience. The hypothalamus lies ventral to the thalamus and regulates autonomic activity and the hormonal secretion by pituitary gland. The cerebral hemisphere. This is largest region of the brain. It consists of the cerebral cortex or gray matter and the fibers which form white matter with deeply located nuclei, the basal ganglia, the hippocampal formation, and the amygdala. The the cerebral hemisphere are divided by hemispheric fissure and are thought to be concerned with perception, cognition, emotion, memory, and high motor functions. Each hemisphere comprises four lobes, example frontal, parietal, temporal, and occipital lobes. Each hemisphere has a flat medial surface which lie adjacent to each other, separated by a longitudinal fissure. In the lower part of the fissure is present a thick band of fibers, the corpus callosum. The hemisphere shows unfolding in the form of sulci and gyri, giving more space for the neurons. Six ventricles of brain. Ventricles are continuous cavities in various parts of brain. Lateral ventricle is cavity of each cerebral hemisphere. Third ventricle is present between the two thalami. It continues as aqueduct of midbrain. Fourth ventricle is cavity of hindbrain. It is pons, medulla, and cerebellum, and continues downward as central canal of spinal cord. Cerebrospinal fluid circulation on the ventricles and subarachnoid space provides nourishment to the component of brain. 7. Protective coverings. Brain and spinal cord are covered by three meninges. With three meninges with intervening spaces. The outermost is the dura mater. Middle layer is delicate cobweb like arachnoid matter, and the inner one is the pia mater. The subdural space is very narrow, while the subarachnoid space is big, containing very important cerebrospinal fluid. Lastly, brain and spinal cord with their meninges are securely kept in the bony skull and vertebral canal, respectively. Central nervous system is the most protected part of the body. Peripheral nervous system. 1. Somatic cerebrospinal nervous system. It is made up of 12 pair of cranial nerves and 31 pair of spinal nerves. Its efferent fibers reach the effectors without interruption. Figure 1.9a. Second, autonomic splanchnic nerve system. It consists of sympathetic and parasympathetic systems. Its efferent fibers first relay in a ganglion, and then the postganglionic fibers pass to the effectors. Figure 1.9b and c. Receptors. The peripheral endings of sensory afferent are ascending, and motor efferent or descending. Nerves are called receptors. Sensory afferent Sensory afferent receptors. The peripheral ending of afferent fibers which receive impulse are known as receptors. Free nerve endings. Sensory nerve endings which repeatedly form plexus of or terminate with fewer branches constitute free nerve endings. Such type of endings are found in connective tissue, dermis of skin, fascia, tendons, ligaments, joints, capsules, peritoneum, perichondrium, and sheath of blood vessels. These are particularly numerous in relation to hair follicles. These endings respond to temperature, touch, and stretch. So these are thermoreceptors and mechanoreceptors. They respond to pain also. Figure 1.10. Merkel disc shaped endings. The nerve fibers of these structures expand into a disc applied closely to the base of specialized non-nervous cell, the Merkel cell, which inserted into the basal cells of epithelium of the epidermis. These are also found around apical ends of certain hair follicles. These are responsive to pressure sensation. Encapsulated nerve endings. These are special end organs. These have one feature in common, that is the termination of nerve is enveloped by a capsule. These may be in dermis, joints, muscles, and tendons. Dermis, tactile corpuscle of Meissonier. These are found in the dermal papillae of skin or of hand, feet, front of forearm, lips, and mucous membrane of tip of tongue. They are cylindrical in shape with long axis perpendicular to deep surface of epidermis and are about 80 micrometer long and 30 micrometer broad. Each corpuscle consists of a capsule with central core. The capsule consists of elastic fibers oriented along the long axis of corpuscle and interspersed with fibrosides. The elastic fibers anchor the corpuscle of the epidermis. The capsule contains number of lamellae of flattened cells with associated basement membrane. The core of corpuscle is supplied by several myelinated nerve fibers and a few unmyelinated nerve fibers. These are responsible for touch. Lamellated Pacinian corpuscle. These are found in subcutaneous tissue on the palmar aspect of hand, plantar aspect of foot, and digits in the genital organs of both sexes, arms, nipple, neck, and in mesentery. These are relatively big in comparison to other end organs and are about 2 millimeter in length and 100 to 200 micrometer in width. The center of the core generally contains a single nerve fiber, the end of which is expanded into a bulb. Lamellated corpuscles are pressure receptors. Raffinis corpuscle. These are also encapsulated nerve endings. They contain collagen bundles which emerge to each end of thin perineural capsule. They are slowly adapting and give a sustained response when the skin is stretched in their long axis. These occupy deep dermis and response when heavy objects are gripped. Functional application. The encapsulated nerve endings and tactile menisci are all mechanoreceptors. Meissoniers and Pacinian corpuscles are rapidly adapting tactile menisci. In medical practice, five modalities are easily tested. These are deep touch, vibration, light touch, temperature, warm or cold, and pain. Raffini corpuscle are slowly adapting. Cross end bulb, mainly found in the mucocutaneous region, example lips and external genitalia. The bulb is spheroidal in shape, about 50 micrometer in diameter. Its capsule is continuous with the endoneurium. The nerve fibers branch into the bulb. It probably receives thermal impulses. Joints, muscles, and tendons. The afferent ending are proprioceptors and furnish the central nervous system with information required for the performance of properly coordinated movements. In addition, proprioceptors information reaches consciousness so that there is awareness of the position of body parts and of their movements. Pain arising in muscles, tendons, and bones is detected by free nerve endings in connective tissue. These are known as nociceptive fibers. The receptors in tendons and muscles are neurotendinous spindle of Golgi. These are found at musculotendinous joints. Each consists of small tendon fibers enclosed in delicate capsule. One of more heavily myelinated group IB nerve fibers, 5 to 12 micrometers, pierce the capsule and divide in a spray-like manner, which become lodged between bundles of collagen fibers. Figure 1.11. Neuromuscular spindles. The prospio, the prospe, the proprioceptive organs contained in the skeletal muscles are neuromuscular spindles. Figure 1.12. They lie in the long axis of muscles, and their collagenous capsule are continuous with the fibrous septa that separate muscle fibers. They are numerous in muscle that perform highly skilled movements. These spindle-shaped sensory end organs are bound by fusiform connective tissue capsule, within which are a few muscle fiber of a special kind. These fibers are called intrafusal fiber, in contrast to extrafusal fiber that constitute the bulk of the muscle. Intrafusal fibers are of two types: nuclear bag fibers, and B nuclear chain fibers. Each spindle contains 6 to 14 intrafusal fibers. These fibers contain several nuclei that are near the middle of a fiber. Each neuromuscular spindle is supplied by two afferent nerve fibers. One of these is group IA, 12 to 20 micrometer fiber. As the fiber pierces the capsule, myelin covering the fiber ends and terminal portion of fiber winds spirally around the mid portion of the intrafusal muscle fiber in the form of annulospiral ring. These are called primary sensory endings. The secondary, the second smaller afferent fiber branches terminally and end in varicosities on the intrafusal muscle fiber some distance from mid region. The later terminals are called flower spray endings. These are also known as secondary sensory endings of the spindle and are present at both ends. The neuromuscular spindle has also an afferent or motor innervation. This is derived from fine gamma neurons of anterior horns of gray matter of spinal cord. Small motor end plates are present at both ends of intrafusal fibers. During muscular activity, intrafusal fibers get stretched, increasing rate of passage of nerve impulse to brain or spinal cord. By informing central nervous system about rate of change of length of muscle, neuromuscular spindle influences control of voluntary muscle. Motor afferent endings. Skeletal muscle. The myoneural junctions or motor end plates on extrafusal and intrafusal fiber of skeletal or striated muscle are synapse-like structure with two components. It is the ending of a motor nerve fiber and subjacent part of the muscle. Figure 1.13. The number of muscle fibers in a motor unit, number of muscle fibers supplied by a single alpha motor neuron, varies from one several hundred depending upon the size and function of a muscle. A large motor unit in which a single neuron supplies many muscle fibers is adequate for the function of muscles such as those of trunk and proximal portion of limbs. However, in extraocular and intrinsic muscle of hand, which function with precision, the motor unit includes only a few muscle fibers. Each branch of nerve fiber gives up its myelin sheath on approaching a muscle fiber and ends as several branchlets that constitute the neural component of end plate. In the majority of muscle, the terminals of the nerve end in a small localized area of muscle fiber, forming a so-called motor end plate. In this region, the sarcoplasm contains many nuclei rich in mitochondria and has granular appearance. This region of sarcoplasm is known as soul plate. There is an interval of 20 to 50 micrometer constituting a synaptic cleft between surface of nerve terminal and that of muscle fiber. The sarcolemma of muscle fiber has a wavy outline where they oppose the nerve terminal, with with irregularities being known as junctional folds. Axon terminal in the Axon terminal in this region is rich in mitochondria and contains vesicles similar to those seen in the region of synapse. There is no protoplasmic continuity between the exoplasm and sarcoplasm. These vesicles in exoplasm contain the neurotransmitter acetylcholine that is released when nervous impulse reaches myoneural junction. Acetylcholine creates a wave of depolarization in the sarcolemma, resulting in contraction of muscle fiber. Thereafter, acetylcholine is quickly destroyed by an enzyme called cholinesterase. Smooth muscles. The contact between nerve ending and smooth muscle is not as close as in skeletal muscle. Axon terminal contains vesicles. In most cases of sympathetic terminals, these vesicles contain adrenaline or noradrenaline. In case of parasympathetic terminals, they contain acetylcholine. Functional classification. Exteroreceptors. Extero, exteroceptor, exteroceptors. These respond to stimuli from external environment. It is pain, temperature, touch, and pressure. Proprioceptors. These respond to stimuli in deeper tissue. It is contraction of muscle, movement, position, and pressure. Interoceptors or enteroceptors. These include receptor end organs in the walls of viscera, glands, blood vessels, and specialized structures in the carotid sinus, carotid bodies, and osmoreceptors. Special sense receptors. These are concerned with vision, hearing, balance, and smell and taste. Clinical anatomy. Myasthenia gravis. It is a consequence of autoimmune destruction of nicotinic postsynaptic receptors for acetylcholine. Thymus abnormality occurs in 80% of patients. Clinical features: limb and trunk, weakness of neck muscles resulting in lolling of head. Proximal limb muscle are preferentially affected. Limb reflexes are hyperactive. Muscle wasting occurs in 50% cases. 15% cases. Diagnosis: acetylcholine receptor antibodies are detected in majority of patients. Competency achievement: the student should be able to AN64.2 describe the development of neural tube, spinal cord, medulla oblongata, pons, midbrain, cerebral hemisphere, and cerebellum. Development of brain. Neural tube. The whole of nervous system develops from ectoderm except the blood vessels and the microglia or neuroglial tissue. At the beginning of third week of development, the ectodermal germ layer has the shape of a flat disc that is broader in cephalic region than in the caudal region. With the appearance of the notochord, and its inductive influence, ectoderm overlying the notochord thickness to form a slipper-shaped plate called neural plate. Cells of the plate make up neuroectoderm, and with induction, the process of neuralization starts. The plate is located in the mid-dorsal region in front of primitive pit. Its lateral edges get raised to form the neural folds. With further development, the neural groove between the two folds on either side become deeper. Eventually, the neural folds approach each other in midline and finally fuse, thus forming the neural tube. Fusion begins in the cervical region and proceed in cephalocaudal direction. At the most cranial and caudal ends of the embryo, fusion is delayed and the cranial and caudal neuropores temporarily form open connection between the base of neural tube and the amniotic cavity. Final closure of cranial neuropore occurs on 25th day and caudal neuropore 2 days later of the embryonic life, and eventually neuropores disappear, leading to a closed tube. Before the neural tube is completely closed, it is divisible into an enlarged cranial part with 3 divisions which form brain and a caudal tubular part which forms spinal cord. The cephalic end of the neural tube shows 3 divisions: prosencephalon or forebrain, mesencephalon or midbrain, rhombencephalon or hindbrain. Further development of the brain. Prosencephalon, mesencephalon, and rhombencephalon are first arranged cephalocaudally. Soon it develops four flexures: Figure 1.14 and B. These are cervical flexure. It appears at the junction of romencephalon and spinal cord. B. Cephalic or mesencephalic flexure. This flexure is located in the region of midbrain. C. Romencephalon flexure. The mesencephalon is separated from romencephalon by a furrow called romencephalic flexure. D. Pontine flexure. When the embryo is 5 weeks old, the pronoencephalon consists of two lateral outbucketings, the primitive cerebral hemisphere. At this stage, a deep furrow appeared at the mid of romencephalon. This is called pontine flexure, and it divides romencephalon into metencephalon and myelencephalon. The flexure changes orientation of various parts of brain. The lumen of the spinal cord, the central canal, is continuous with that of primitive brain vesicles. The cavity of rhombencephalon is known as fourth ventricle. Those of cerebral hemisphere are lateral ventricles, and cavity of diencephalon is third ventricle. Cavity of lateral ventricles communicates with that of third ventricle through interventricular foramen of Monro. Cavity of third and fourth ventricle is connected through narrow cerebral aqueduct of Salvius. Figure 1.15. Neural crest cells and their derivatives. During folding of the neural tube, a group of cells are formed along each side of neural groove, and after the formation of neural tube, lie between the surface ectoderm and neural tube. These cells, ectodermal in origin, migrate laterally. These cells, ectodermal in origin, migrate laterally and are called neural crest cells. They extend from prosencephalon at the cranial end of the tube to the level of caudal somites. Figure 1.16. Derivatives are primitive cranial ganglia, primitive spinal ganglia. 1. Primitive cranial ganglia. Sensory ganglia of 5th, 7th, 8th, 9th, 10th cranial nerves. Parasympathetic ganglia, ciliary, otic, submandibular and pterygopalatine. Pia mater and arachnoid mater, leptomeninges. Second, primitive spinal ganglia. Dorsal root ganglia of spinal nerves, sympathetic ganglia, adrenal medulla. Third, from both 1 and 2, pharyngeal cartilage cells, chromaffin cells, pigment cells or melanoblasts, Schwann cells, satellite cells, odontoblasts, mesenchyme of head region, capsular cells of ganglia. Diencephalon. The median part of prosencephalon forms diencephalon. It comprises a roof plate and two alar plates. The choroid plexus of third ventricle is formed from ependymal cells of roof plate and the vascular mesenchyme. After the formation of the telencephalon, the lateral wall of diencephalon becomes thickened and gets divided into three regions by appearance of the by appearance of two sulci. These are called epithalamic and hyothalamic sulci, and the central part between the two sulci is called thalamus. The part above the epithalamic groove is a small region represented by habenular nuclei and pineal body. The part below the hypothalamic groove forms hypothalamus. Pineal body or epiphysis develops from the most caudal part of roof plate. The pineal body initially appears as an epithelial lining in the midline, but by the 7th week of intrauterine life, it begins to vaginate. It begins evaginate. Eventually, it becomes a solid organ located on the roof of the mesencephalon. It serves as channel through which light and darkness affect endocrine and behavioral rhythms. It is circadian rhythm. In the adult, calcium is frequently deposited in the epiphysis, and it even serves as a landmark on an X-ray skull. As a result of proliferative activity, the various nuclei of thalamus are formed by multiplication of cells in the mantle layer of the wall of diencephalon. Hypothalamus, forming lower portion of the alar plate, differentiates into a number of nuclear areas which serves which serves as regulation center of the visceral function. It is sleep, digestion, body temperature, and emotional behavior. The prominent group of this nuclei is mammillary body, which form distinct protuberance on the ventral surface of the hypothalamus on each side of the midline. Telencephalon. The telencephalon consists of two lateral outpocketings, the cerebral right and left hemisphere, and median portion, the lamina terminalis. The cavities of hemisphere, the lateral ventricles, communicate with the lumen of diencephalon through the intraventricular foramen of Monro. Cerebral hemisphere. Cerebral hemisphere arise as bilateral right and left evaginations at the beginning of fifth week of development from the lateral wall of prosencephalon. By the middle of second month of development, the basal part of hemisphere, it is the part which is initially formed by the forward extension of thalamus, begins to increase in size. As a result, this area bulges into the lumen of the lateral ventricles as well as the foramen of Monro. In the region where the wall of hemisphere is attached to the roof of diencephalon, the neuroblast failed to develop and it remained very thin. Here, the hemispheric wall consists of single layer of ependymal cells covered by vascular mesenchyme, and together they form choroid plexus. Due to disproportionate growth of various part of hemisphere, the choroid plexus protrudes into lateral ventricles along a line known as choroid fissure. Above the choroid fissure, the wall of hemisphere is thickened, thus forming the hippocampus, which mainly has an olfactory function, and this part bulges into lateral ventricle. With further growth and expansion, the hemisphere cover the lateral aspect of diencephalon, mesencephalon, and cranial portion of metencephalon. Corpus striatum. Some of the cells of the mantle layer in thick basal part of lateral wall of hemisphere form corpus striatum. It expands posteriorly and gets divided into two parts: a dorsomedial portion, the caudate nucleus; b, a ventrolateral portion, the lentiform nucleus. This division occurs by axons passing to and from the cortex to the hemisphere. The fiber bundle thus formed is known as internal capsule. Figure 1.17. Lobes of brain. Continuous growth of cerebral hemisphere in anterior, dorsal, posterior, and inferior direction results in formation of frontal, parietal, occipital, and temporal lobes. As the growth in the region of corpus striatum slows down, the area between temporal and frontal lobe become depressed and form the insula. The area is later overgrown by adjacent lobes. At the time of birth is almost completely covered. In lateral part of fetal life, due to growth in a limited area, the sulci and gyri make their appearance. This is to accommodate more neurons in a limited area. Figure 1.18. Cerebral cortex. From development point of view, the cerebral cortex consists of the hippocampal cortex, piriform cortex, the neocortex. The developing telencephalon has a medial wall opposed on the counterpart of the opposite side, a superior lateral wall and a basal wall. The hippocampal cortex develops in medial wall. Piriform The hippocampal cortex develops in medial wall, piriform cortex in the marginal layer superficial to corpus striatum, and neocortex in the superior lateral region. Earlier formed cells are neuroblasts. Motor areas of the cortex are rich in pyramidal cells, while the sensory areas have abundance of granular cells. Cerebral commissure. In the adult, the right and left halves of the cerebral hemisphere are connected by a number of fiber bundles called commissures, which cross midline. The most important is lamina terminalis. It is part of the wall of the neural tube that closes the cranial end of the prosencephalon. After the appearance of telencephalon vesicles, lamina terminalis lies in the anterior wall of third ventricle. Neuron growing from one hemisphere pass to the other through the lamina terminalis, so it becomes thickened to form commissured plate. Anterior commissure. The first of the crossing bundles to appear is anterior commissure. It consists of fibers connecting the olfactory bulb and related brain areas of one hemisphere to those of opposite side. Hippocampal or fornix commissure is the second to appear. Corpus callosum, it is the most important commissure. It appears in the 10th week of development and connects non-olfactory area of right and left side. Optic chiasma. It appears in the anterior wall of the diencephalon and contains fibers from medial halves of two retinas. Development of spinal nerve roots. Motor nerve begin to appear during the fourth week of development, arising from nerve cells located in the basal lamina ventral horn of spinal cord. Dorsal nerve roots form the collection of fibers arising from the cell of the dorsal root ganglia, spinal ganglion. Central processes form these ganglion form bundles that grow into spinal cord opposite the dorsal horn. Almost immediately, spinal nerve divides into dorsal and ventral rami. Dorsal primary rami supply dorsal axial musculature and skin of back. Ventral primary rami supply limbs, ventral body, wall and form major nerve plexus. It is cervical, brachial and limbosacral plexus. The peripheral process of the dorsal nerve root ganglia grow upwards to form sensory component of the spinal nerve. Axons of neurons in the dorsal gray column enter marginal layer to form ascending tract of the spinal cord, and the axons of cells of neurons developing in various parts of brain enter the marginal layer to form descending tracts. As the mantle layer forms the dorsal and ventral columns, the white matter becomes subdivided into dorsal, ventral, and lateral white columns. Positional changes of spinal cord. During the third month of intrauterine life, the spinal cord extends the entire length of embryo. Due to rapid growth of dura mater and vertebral column as relative to the neural tube, the terminal end of spinal cord is located at, at birth at the level of third lumbar vertebra. This process of recession continues after birth, as a result of which in the adult spinal cord usually ends at the upper border of second lumbar or at lower border of first lumbar vertebra. Below this level, a thread-like extension of pia mater forms filum terminale and is attached to the periosteum of coccyx. Nerve fibers below the level of cord are called cauda equina, horsetails. Because of this recession of spinal cord, the intervertebral foramen no longer lie at the level at which corresponding nerve emerges from the spinal cord. The nerves run obliquely to reach their respective foramen. The obliquity is least in lower cervical region, gradually increase and is more in lumbar, sacral, and coccygeal region. Example figure 1.19a and b. One advantage of this recession of spinal cord is when cerebrospinal fluid is tapped for diagnostic purpose during a lumbar puncture, the needle is inserted at the lower lumbar level, avoiding the lower end of the cord. Development of medulla oblongata, pons, and midbrain is given in Chapter 5. Development of cerebellum is incorporated in Chapter 6. Parts of brain. The main parts and their subdivision are shown in Table 1.3 and Figure 1.20 and B. The brainstem includes the midbrain, pons, and medulla. Hindbrain includes pons, medulla, and cerebellum. The dilated part of the central canal of spinal cord within the conus medullaris is known as the terminal ventricle. Similarly, the cavity of septum pellucidum is sometimes called the fifth ventricle. Table 1.3 Parts of brain. Parts subdivision cavity. Forebrain prosencephalon. A telencephalon subdivision. A telencephalon cerebrum made up of two cerebral hemisphere and the median part in front of the interventricular foramen. Cavity lateral ventricle. B diencephalon. B diencephalon thalmencephalon hidden by the cerebrum consists of A. Thalamus, B. Hypothalamus, C. Metathalamus, including the medial and lateral geniculate bodies, and epithalamus, including the pineal body, habenular trigon, and posterior commissure subthalamus. Cavity, third ventricle. Second, midbrain, mesencephalon, crus cerebri, substantia nigra, tegmentum, and tectum from before backwards. Cavity, cerebral aqueduct. Third, hindbrain, rhombencephalon. A. Mesencephalon made up of pons and cerebellum. B. Melencephalon or medulla oblongata. Figure 1.20b. Fourth cavity, fourth ventricle. Molecular regulation of development of spinal cord and brain. Spinal cord comprises basal or motor plate and alar or sensory plate. Sonic hedgehog SHH is expressed in notochord. SHH ventralizes neural tube and forms basal or motor plate. Bone morphogenetic protein BMP4 and BMP7 expressed from non-neural ectoderm at border of neural tube dorsalizes the neural tube. Brain. Hindbrain is regulated by HOX genes. Forebrain and midbrain regulated by LIMI and OTX2, also governed by A. Anterior neural ridge, fibroblast growth factor 8, FGF8. Cranial end of forebrain expresses BF1, gives control development of telencephalon. B. Rhombencephalon isthmus gives FGF8, gives isthmus expresses ingrained genes, controls development of midbrain and cerebellum. Clinical anatomy. Down syndrome. Down syndrome DS is a set of physical and mental traits caused by gene problem which happens before birth. The affected person may have some degree of intellectual disability. Normally a person has 46 chromosomes, but a person with DS has 47 chromosomes. Having extra or abdominal chromosomes changes the way the brain and body develops. Clinical features: flat face, small ears, slanting eyes, small mouth, short neck, short arms and legs, low muscle tone, loose joints, and below average intelligence. Cerebral palsy. It is a neurological disorder by a non-progressive brain injury or malformation that occurs while the child's brain is undergoing development. The brain damage is caused by brain injury or abnormal development of the brain that occurs before birth, during birth, or immediately after birth. Cerebral palsy may be of different types. Clinical features: affected parts are body movements, muscles control, muscle coordination, and muscle tone. Craniosynostosis. Cranium syn together ostosis relating to bone is a condition in which one or more of the fibrous suture in an infant very young skull prematurely fuses by turning into bone ossification. Attention deficit hyperactive disorder, ADHD. Attention deficit hyperactive disorder, a disorder that includes difficulty staying focused and paying attention, difficulty controlling behavior, and hyperactivity. ADHD is not considered to be a learning disability. Autism is a neurodevelopmental disorder characterized by impaired social interaction, impaired verbal and non-verbal communication, and restricted and repetitive behavior. Autism affects information processing in the brain by altering how nerve cells and their synapses connect and organize. How this occurs is not well understood. Symptoms: impaired social interaction, impaired verbal and non-verbal communication, restricted and repetitive behavior. Causes: genetic and environmental factors. Convulsion. Convulsion, a sudden, violent, irregular movement of the body caused by involuntary contraction of muscle and associated especially with brain disorder such as epilepsy, the presence of certain toxins or other agents in the blood, or fever in children. Epilepsy is a chronic disorder, the hallmark of which is recurrent, unprovoked seizure or convulsions. A person is diagnosed with epilepsy if they have two unprovoked seizures or one unprovoked seizure with the likelihood of more that were not caused by some known and reversible medical conditions like alcohol withdrawal or extremely low blood sugar. Spinal stenosis is narrowing of the spinal canal. The narrowing of the spinal canal limits the amount of space for the spinal cord and nerves. Pressure on the spinal cord and nerves due to limited space can cause symptoms such as pain, numbness, and tingling. Spina bifida. Spina bifida is a birth defect where there is incomplete closing of the backbone and membranes around the spinal cord. There are three main types: spina bifida occulta, meningocele, and mylomeningocele. Mylomeningocele. The most common located in the lower back, but in rare case it may be the middle back or neck. Occulta has no or only mild signs. Sign of occulta may include a hairy patch, simple dark spot, or swelling on the back at the site of the gap in the spine. The meningocele typically causes mild symptoms with a sac of fluid present at the gap in the spine. Guillain-Barré syndrome is a rare but serious autoimmune disorder in which the immune system attacks healthy nerve cells in one peripheral nervous system. This leads to weakness, numbness, and tingling. It can eventually cause paralysis. The cause of the condition is unknown, but it is typically triggered by an infectious illness such as the stomach flu or a lung infection. The symptoms of Guillain-Barré include tingling or prickly sensation in fingers and toes, muscle weakness in legs that travels to upper body and get worse over time, difficulty in walking steadily, difficulty moving eyes or face, chewing or swallowing, severe lower back pain, loss of bladder control, fast heart rate, difficulty breathing, paralysis. A stroke. A stroke occurs when the supply of blood to the brain is either interrupted or reduced. When this happens, the brain does not get enough oxygen or nutrients, and brain cells start to die. Ischemic strokes are caused by arteries being blocked or narrowed, and so treatment focuses on restoring an adequate flow of blood to the brain. Hemorrhagic strokes are caused by blood leaking into the brain, so treatment focuses on controlling the bleeding and reducing the pressure on the brain. Chiari malformation. Malformation is a condition in which brain tissue extends into the spinal canal. It occurs when part of the skull is abnormally small or mishappen, pressing on the brain and forcing it downwards. Chiari malformation is categorized into three types depending on the anatomy of the brain tissue that is displayed into the spinal canal. Chiari malformation type 1 develops as the skull and brain are growing. As a result, signs and symptoms may not occur until late childhood or adulthood. The pediatric forms, Chiari malformation type 2 and type 3, are present at birth, congenital. Gross study of brain. Brain can be studied by viewing it from following sites. Figure 1.21a to f. Brain can be cut in the following planes. Coronal plane. First one, coronal plane, when brain is cut through dorsal and ventral surface in the coronal plane. Figure 1.2. Figure 1.22 a to c. Second, horizontal plane, when it is cut from side to side. Figure 1.22d. Third, sagittal plane. When brain is cut in relation to longitudinal axis, it is from anterior to posterior aspect. Figure 1.22e and f. Fourth, oblique plane. When brain is cut at an angle from cerebral cortex down through the brainstem. Figure 1.22g. Facts to remember. Neurons in human brain are about 180 to 200 billion. Mature neurons do not divide after birth except in olfactory region and in hippocampus. If neurons divide, one will have fleeting memory. Impulse travels from dendrite to cell body and then into axon. Contact between neurons is by contiguity, like handshake, and not by continuity. Human has the largest cerebrum so far. Ependymal cells are responsible for the formation of cerebrospinal fluid. Astrocytes form the blood-brain barrier. Clinical anatomical problems. A man aged 60 and his son aged 12 had injury to their arm region and wrist region respectively in an automobile accident. Who will have better return of functions? More effective regeneration will be in the father or son. And answer why? And why? Answer: all repairs occur faster in younger than older person, so the son's injury will heal earlier. More effective regeneration will be again in son, as the injury is in distal area. In a distal area, a few structures are left to be supplied, so there are few chances of innervating the wrong structures during the reparative process. Frequently asked questions. Write short notes on synapse, neuroglial cells, parts of nervous system, D reflex arc, Babinski signs. Multiple choice questions. What nerve fibers convey some impulses towards cell? Body of axon. Body of axon. A axon, B dendrites, C axon collaterals, D axon terminals. Second, myelin sheath on peripheral nerves is contributed by A axon itself, B secretory vesicles, C Schwann cells, D cell bodies of neuron. Third, a neuron with many dendrites arising from cell body and carrying impulse away from the neuron via the axon is A multipolar, B bipolar, C unipolar and sensory, D bipolar and motor. Fourth, the great appearance of spinal gray matter is due to A neuronal body, B neuroglia, C neurites, D blood vessels. Fifth, which type of cells help regulate composition of cerebrospinal fluid? A astrocytes, B oligodendrocytes, C microglia, D ependymal. C. Name of the type of neuroglial cells that aid regeneration by forming a regeneration tube to help establish firm connection. A. Schwann, B. Astrocyte, C. Microglia, D. Ependymal. So, in what cells? 7. What cell conduct message towards brain? A. Motor neuron, B. Sensory neuron, C. Interneuron, D. Neuroglia. 8th, myelin sheath is produced by A. Neuron, B. Axon, C. Dendrite, D. Schwann cells or oligodendrocytes. Ninth question. The three regions of brain stems are A. Cerebrum, the three regions of brainstem are A. Cerebrum, diencephalon, midbrain, B. Pons, cerebellum, midbrain, C. Diencephalon, midbrain, cerebrum, D. Midbrain, pons, medulla oblongata. The three parts of hindbrain are A. Cerebrum, pons, cerebellum, B. Pons, medulla oblongata, cerebellum, C. Pons, midbrain, cerebellum, D. Thalamus, pons, cerebellum. Chapter completed. Thanks for watching.